Well, thanks for coming along. 6 weeks out from the half Ironman, 6 weeks and 2 days. And we're excited and very pleased to be partnering Triathlon WA in the half Ironman and in triathlon in Western Australia. So I will introduce the team. We've got a couple of additional people hanging around here, but we've got a couple of physiotherapy clinics. Our main ones are in West Perth and Mosman Park. We've also got a small clinic in the city. We did have a clinic in South Perth that we've recently decided our time was better spent in the city, so apologies if you've got the noise on South Perth. You'll have to drive 11 minutes over the city. We've worked it out. But we've ended up with an interesting team of people around us, all that are very interested and passionate, and a few of us, or a few of them, are very good at triathlon. And because of our interest and a bit of personal experience, we think we've got a fair bit to offer you guys. So tonight we're going to talk a little bit about physiotherapy management of triathlon injuries, what we think we do well, what we think can be done badly. And our obvious focus tonight is on that last 6 weeks and things that we think you should and shouldn't be doing in the last 6 weeks if something goes wrong, and maybe things that can go well also. So what we're going to do tonight, we're going to be opening up with James Debenham. A lot of you guys will know James. James works with us, is also a lecturer down at Notre Dame University. He is finishing off his PhD looking at particularly Achilles tendon problems and lower limb loading. James last year presented his tendon research at the International Congress for Tendons, which is a pretty big deal. James has also been a previous West Australian Triathlete of the Year, so he sort of knows his way around the triathlon course and went to Kona last year. So we're very fortunate to have James along with us tonight. I'm going to follow up from James. So James is going to talk particularly about what happens if you get an injury, a few things to think about, what you should and shouldn't do. I'm going to jump in second. My name's Damien Oldmeadow. My history in this is more to do with the cycling side of things. I've had a go at a couple of half Ironmans and got through them, but fairly slowly. But I certainly understand the sport pretty well. I've been involved with cycling from a junior, from working in bike shops. I've worked with elite cycling in Australia, the AIS, and for the UK team as well. So I've done a fair bit of cycling stuff, and what I'm doing, spending most of my time at the moment doing is bike fitting. And our speciality, obviously being physios, is bike fitting for people who've got injuries, discomfort, getting problems. But we also do performance bike fitting, and I've had some great experience working with some very, very high-level cyclists and triathletes. Dr. Merv Travers is going to be our third speaker tonight. Merv and James have colluded in their research over the last 5 years or so. Merv has completed his PhD last year, and his was also looking around the lower limb and loading. Merv, on top of that, is about to get his level 2 in the Australian Strength and Conditioning Association. So he's a physiotherapist with a postgraduate degree in manipulative physiotherapy, level 2 Australian Strength and Conditioning Association, and a PhD. So he's a reasonably useful guy with a little bit of knowledge, and he's going to do his first half Ironman down at Busselton this year. So we're very pleased about that. Now, we've also got a couple of our other crew in the room with us. James Lewin, wake your hand up for us, Jimmy. James, also a previous WA Triathlete of the Year and state champion for the half Ironman 2 years ago. James is a second year physio student, and he's doing some bike fitting alongside me. Kate Luckin, put her hand up here. Another triathlete, has qualified for Kona this year, physiotherapist. And we've got Rose Cason up at the back there. Rose isn't a triathlete, but she's got a black belt in karate, so if anyone's got any problems, she's looking after us tonight. So we're going to have 3 speakers, and then our idea is going to be, at the end of that, we want to have a bit of a Q&A. Hopefully you'll pick up some things, and by all means, if you've got a burning question, don't feel like you've got to wait till the end. Whack your hands up. We're happy to answer questions on the fly as we're going. Hopefully you'll get lots out of the talk tonight, and as I said, we're very happy to help out with individual questions later on. If you've got something particularly you want to know about yourself, we're more than happy to try and help out as best we can. And we hope you enjoy the night.